People manning the home recovery hotline are picking up 95% of the calls they receive daily. And that's an improvement from the early days of the program. But authorities say they are still looking to do better. Mobile medical teams will be rolled out soon to help elderly patients who aren't tech-savvy. Liang Lei with more.
When a large number of COVID-19 cases were put on the home recovery program last month, some 200 military personnel were called in to help. That number has now risen to over 450 people, including regulars, full-time national servicemen and volunteers. More than half of them man hotlines to answer queries and register people for home recovery. This has resulted in greater efficiency. 9 in 10 home recovery patients are registered within a day of providing their details. The Singapore Armed Forces is also reaching out to vulnerable groups.
At the same time, we are working with community partners such as PA, AIC, as well as volunteers from the public service to provide social assistance, especially to the vulnerable and needy groups.
The Health Ministry has also streamlined its workflow to respond quicker to telemedicine requests. Currently, 85% of patients get to a doctor within a day, compared to just 50% earlier this month.
Now we must remember these are not people who are gravely ill. These are people who may have had slight symptoms and they want to talk to a doctor. The doctor calls them within 2 hours, latest 4 hours, up to 90%. So I think that has been working very well for us as well. And this, I must add, is despite the fact that we are seeing larger number of cases day on day.
However, there are still some issues. For instance, some landlords evicting COVID-19 positive tenants. These people will be housed in recovery facilities, and authorities say the number of such incidents remains small.